At Northwestern in 3 years, then went on to Tulane Medical School, and as you know, graduated in 1966, member of the AOA, was a surgical intern at the University of California, San Francisco, was in the U.S. Navy from until 1970, served in Vietnam from 1968 to 1969, then did his residency in ophthalmology at USC. Followed by a fellowship in pediatric ophthalmology at the Wilbur Eye Institute in Baltimore. No. He's authored 90 papers and review articles for numerous journals, presented 27 papers at national meetings, was also a member of the prestigious Ophthalmologic Society, has received awards from the American Association of Pediatric Ophthalmology and Strabismus, and the American Academy of Ophthalmology. From 1982 to 2014, Dr. Pollard was director of the James Hall Fellowship in Pediatric Ophthalmology at the Scottish Rite Children's Medical Center in Atlanta. He's trained 35 fellows in pediatric ophthalmology. For all of these accomplishments and his work as an exemplary physician, we present Dr. Pollard with the TMA Lifetime Achievement Award. Please come.
Wow, it's really hard to believe that 54 years ago, Tulane University threw into this cauldron 130 men and women with raw and purely undeveloped talent, and turned over to the faculty the job of turning us into physicians. I remember the first staff member that I met was Dr. Peebles in anatomy, which took 100% of our discipline just to pass that darn course. And I remember Dr. Varela, who was one of the most wonderful teachers in the dissection of our cadavers. We also had a lot of help from our own classmates, Jimmy Long, John Aiken, Ed Edgerton, Henry Tiefert, Bobby Applebaum, and Howard Hurdig. They were lab instructors for our first year. Our second year, I remember Charlie Genre, you were being a pathologist, you'll remember the words of our chairman of pathology, Dr. Charlie Dunlap, when he said to us, "You're all very lucky and fortunate to be physicians. You're receiving this great reputation of something that you have done nothing to deserve, yet you have all the responsibility to continue through your lifetime." My junior year, I was very fortunate to spend 3 months with Fred Hunter and learned a lot about GI and liver. In my senior year, Richard Tannehill and I spent many hours together working at the VA under the tutelage of John Phillips, a wonderful cardiologist who taught us a lot about auscultation of the heart and even how to read those little funny bleeps back in the road that they call EKGs. Then they stirred the cauldron up a little more, and after graduation, out came George Blankenship, who became chairman of the Department of Ophthalmology at Hershey and went on to become president of our American Academy of Ophthalmology. Jay Kratchmer, my lab partner, the sophomore year in medical school, became chairman of the Department of Ophthalmology in Minnesota, and he's written 3 textbooks on the cornea. Howard Hurdig, 40 years as a neurologist at the University of Pennsylvania. One job, that's really something in academia to have one position for so long. And Joe Sackett, chairman of the Department of Ophthalmology at the University of Wisconsin.
Radiology.
Radiology. I have a son that's a radiologist, so I should have known that. And here in New Orleans, Bob Jones joined the faculty as a chest medicine professor, and our own beloved Lee Nesbitt became chairman of the Department of Dermatology at LSU. And Tom Whitecloud, a classmate who we lost to early in life, became chairman of the Department of Orthopedics. I remember one night several years ago, Lee Nesbitt called me and enticed me to come down here to New Orleans, and the two of us went to the New Orleans Museum for the dedication of Tom Whitecloud's collection of Native American memorabilia. It was quite an evening. And what about the rest of my classmates that have been in the trenches all these years, seeing patients day after day, week after week, month after month? I think of what's happened in radiology. Jack Buffkin, John Rose. What is it like to now in one day's work to have to look at 1,000 digital images and maybe write on 999 and miss something on the 1,000th one? I think about neurosurgery. Donnie Calanti, Bobby Applebaum, John, all the sleepless nights, taking care of people in car accidents, our orthopedist Lee Leonard. And my good friends in OB, Jim Lyons, and my good friend Roberto Adams, the amigo. How many times have you followed patients through 9 months and then had to lose somebody, lose a pregnancy at the end of a long relationship? Will Nakashima, close friend, 40 years of internal medicine. I wonder how many families he's had to console with the loss of a dear one. And Russell Wu, how many chests have you cracked only to find a tumor grown beyond its realm of resectability or cure? And then, of course, the oncologist, Bill Weaver, taking care of our most fragile patients at the most perilous times in their lives. And in the end, I also think of Sandy Leaf, Tyler Payton, Peter, and I, sitting on that couch 8 hours a day, year after year in psychiatry, listening to people pour out their problems and most inner thoughts. It's interesting. I'd like to thank the committee for this honor, which I will cherish my entire life. And I want to thank Tulane University School of Medicine for taking a chance on a son of two poor Polish immigrants to give me a spot in the class of 1966 with such an eclectic and wonderful bunch of classmates. I wish you all a wonderful long life